Hello, my friends. Welcome back to my channel. This is Vlada. I am very grateful that you stopped by to join me today as I have something very exciting to share with you. I am now certified in health numerology. This is a one-of-a-kind methodology by Iron and Julie Poe, who are the absolute global leaders right now in the world in numerology. They have created several different fields in this science, and 2 years ago they originated health numerology, the goal of which is mostly to prevent different health issues and challenges that are inevitable if we don't address certain areas, certain aspects of our lives. We are all going through different phases throughout our lifetime, during which we need to focus on different aspects of our lives. And if someone is already experiencing health challenges, we can go and we can look where it started, what psychosomatic factors contributed to the person getting sick, because from what I learned, all of our illness starts on a psychological level. It starts with emotions, it starts with feelings, it starts with negative energy, etc. So besides the physical factors, besides us perhaps not taking good enough care of ourselves, there are those factors as well. And 5 years prior to any physical clear symptoms that show up, psychosomatic factors come into play. So now I have this amazing tool that I cannot wait to get out there to share with you, to be able to soften the karmic blow, to be able to address the issues that are imminent, to be able to avoid certain issues, and to look at the overall picture. You will be able to see clearly how strong or how weak your immune response is right now. How would you stand up to COVID-19 right now, this month? A few months from now, we do the prognosis of that. Which factors are contributing to the fact that you are not feeling so well right now? There are different mistakes that we make, errors that we make in our lives. Some of them were made years prior to an actual illness starting. Believe it or not, even changing one's name can hinder their existence. It can improve it as well. So I invite you to ask me questions, message me. I would love to do something for my subscribers who message me on Facebook. I am on facebook.com/livingnumbers123. Or you can go to my personal page, Vlada Rybak, Rybak, and message me. And I will share with those of you who message me your personal biorhythms, which are very important to know. These are the rhythms that show your active versus passive phases during the day. This will be possible to be done for those who know their time of birth. If you don't know your time of birth, it will just take me some time to figure it out. So I won't be able to help as many of those people who don't know their time of birth. So the first three I will look into, and the rest of you, unfortunately, if you are willing to wait, then I will do it later on, because I have so many requests for this. Why do we need to know our biorhythms? The active phases are the ones in which you are recommended to intake any kind of medication if you're prescribed something, to be active, as it sounds, right? To be intaking food. And if, God forbid, any medical treatment, surgery, let's say, is required, it can be planned, and it needs to be planned during those active phases. You will not be in the green zone. You will not be safe in the face of malpractice, mistakes, in the face of complications, and things can go wrong many different ways if you receive medical treatment during the passive phases in which your body is just asking to rest and is not ready to be attacked in that way. This is very important. This methodology is being currently and successfully used by medical doctors who have confirmed that the course of the treatment, the length of the treatment, is now reduced for those people for whom they consider their natural biorhythms that are calculated with this numerology method. They're more successful in the treatments of these patients. They are more accurate in the diagnosis even. Now, this is not to tell you you don't need medical doctors. You will be still sent to a doctor if you have, if I see that something is clearly requiring medical attention. But if your doctor is open-minded enough and willing to hear an input of a certified health numerologist, they are more likely to succeed in the treatment of such a patient. The methodology was created with the input and with extensive research using the data of thousands of patients that volunteered their information. This research was performed by a PhD academic in medicine who has years and years of practicing as a medical doctor as well in Western Europe and in Eastern Europe. This is not just numerologists doing their job. They collaborated with a very serious academic, and she is also, this is all one person, she is also a psychotherapist. So she was able to draw the connection with the psychosomatic factors and the pathology of disease. And they together tested this and tweaked it where it was needed to make it as precise as possible. And they have had so many positive results that I simply had to look into it. As soon as I heard about this methodology, I promised myself I will get a ticket and go to where they are, wherever it is they are, to get this certification, to gain this knowledge so that I can help people. Some of you know that I have a little bit of pre-medical experience and even spent a little time in nursing school, and it really didn't align with me internally. Just being in the medical field turned out to not be my path. So I finally found this way in which I can actively and in such a real way help people address possible health challenges, help them protect themselves from these things. You can learn your critical age at which your cells no longer regenerate as fast, or let's be honest, they stop regenerating and the aging process starts. And that is individual for every person. The only thing we need information-wise from you is your family last name with which you were born. It doesn't matter whether it was ever used or not in documents. It needs to be the last name of the biological father at the time that you were conceived. This is very important. We need to know which country, which alphabet was used at the time in that country where he resided, where you were conceived and born. If you were conceived in one country and born in another, then that matters for us as well. We need to know your full name and the current name that you're using. We don't really care for the ones in between. We need your current name as well, because we are inputting that in the program. The program is what calculates everything, so there are no mistakes. There's no human error here, because I take it very seriously, and they put 1,000% effort in order to avoid human errors here, because we're dealing with human health and life. So these things are very serious. And I encourage you to ask me questions and find out more about it, because there's so much more. You can see the graph of your health throughout your life. Moving to a different country changes as well. Your health graph, your immunity graph gets affected. And through different phases in life, you need to be focusing on different aspects to improve your attitude, to improve your behavior in certain ways. You know, there are times during which we need to be extra attentive to our own selves. Be grateful for even our mistakes. We need to let them go. We need to be grateful for our experiences and become certain of ourselves and just go forward. And if we don't, guess what? Illness will catch up with us. Then there are times in which we have to give maximum attention to our family, and if there is a conflict, we need to try to resolve it. If there's an imminent, let's say, divorce, God forbid, during that phase of your life, you have got to wait it out and not get divorced at the time, at least not on paper, because it will lead to practically guaranteed health issues. And if it doesn't register how it works, the universe, it makes sense up there. It works. And it is always and constantly sending us lessons and sending us tests, which a lot of us unfortunately don't pass. There are other aspects that play a role, and the biggest one, 90% of people get ill, unfortunately, due to the aspects in their career, business, self-actualization, the way they feel when they're dissatisfied with the way they are expressing themselves, whether it be professionally or creatively. You have to work on those aspects, and it will help prevent future health issues. Please contact me with any questions. The best way is on Messenger, Facebook, Living Numbers. My business page has my phone number, and there's so much information that there is to share about this, and I just cannot wait to discuss this with you. We'll talk to you soon. Be safe. Take care of yourself.